Hip stretches, very important because they contribute a lot to your back, to your walking, to your posture. So I want to do a complete stretches for the hip that should help you. Okay. First, you start with, you can hang on to something if you have issues with balance or support yourself. And let's say I'm stretching, I'm mobilizing the right hip. So I want to start by just simple back and forth, back and forth. Okay, like so. You could do it if you have a good balance, but you can hang on to something and you can go back and forth, maybe 10 times, okay? And then the next one, what I want you to do, you always want to do both sides, by the way. It's a good idea, even though one could be stiff, but you want to balance in both. So you do back and forth 10 times, okay? The next thing I want you to do is you bring your leg forward, like so, and you go in and out, in and out. Make sure you keep a good posture and you're just working right to the hips, back and forth. And you could do it slow, don't do them fast. And it could be, if it's like a small range, if you have a lot of stiffness, it's a little bit, it's okay. You'll work into increase. You'll notice as you're doing these, you'll be able to do more range, okay? So if you have just a little bit of movement, that's okay. Don't be discouraged. Just keep doing them. You do 10 times, then you do the other side, the same thing, okay? So you go in and out, in and out, okay? 10 times, okay? The next one, what I want to show you is you want to do circular motion, and I'm doing the right, so I can go around small circles. You can do them slowly, gentle, and you might feel like cracking or snapping or some movement in here, or if it's painful, just do them as smaller circles, whatever you can, okay? Based on, because some people have arthritis and they are very stiff, so you won't be able to have maybe a larger range of movement. So even a smaller one would be fine. And then you do counterclockwise. You want to do always both. Then you do about 10 times. Then you do the other side, the same thing, right? Okay, we're starting with counterclockwise 10 times, and then clockwise 10 times, okay? And then the next one is basically you bring it a little bit forward, and what I want you to do is turn it in and turn it out. Internal rotation, external rotation, internal rotation, external rotation. So you could just go back and forth, back and forth. One technique is to turn it and hold it, and then back and hold it. But I like to just kind of move it back and forth. And you do that for about 10 times. You do the other side, the same thing, okay? So this helps at the socket joint, the hip, so it can move the femur where it attaches on the hip joint. It helps to loosen it up right in there. And if there's any adhesion, scar tissue from inflammation, arthritis, that will break it up. Okay, now the next couple of them I'm going to show you on the ground. It's hard to do them standing. And what you do is basically, I'm going to use this pillow here, and I'm going to lay down on my back like so, okay? And let's say I want to start with my left one. So what I do is I grab my knee like so. If you have knee issue, you can grab it from underneath here, okay? If not, you can grab it and pull it as far as it goes. Now the other one, it could be flat or it could be bent. I like to keep it a little bit bent because it takes the pressure off your low back, and that we can just focus on the hip. So you hold it for 10 seconds. Every 10 seconds, take out the slack 3 times, okay? And then when you finish that, you do the other side, okay? So you hang on to it. I pull to as far as it goes, and let's say it stops here, I just hold it for 10 seconds. After 10 seconds, I pull some more and hold it for another 10 seconds, and the third time, okay? Then the next one, what I want you to do is cross your leg like so, okay? And then with this arm, you just push down. This one will get that rotation in the hip right here. Of course, you're doing other stretches in your low back, but this is wonderful for the hips. I show these exercises for low back relief, but the hips is a key player in low back anyway, so this will help your low back as well. So you're pushing down every 10 seconds, take out the slack and push down, okay? 10 seconds, push down. Now don't rock it or snap it. Do it very gentle, very slowly, 3 times. Then pull it to the opposite shoulder. You could use this arm this way, or you can assist it like this, and you try to like bring it to the side and kind of up to the opposite shoulder like that. Every 10 seconds, pull the slack and take it up, okay? You do the other side, the same thing. So we're doing down, we're holding it for 10 seconds, taking out the slack, holding it. This arm can either push on the same side, or you can grab this ankle if you have long arms like I do, okay? But it could be just one hand like that 3 times, and then grab it. It's good to grab it with both and go to the opposite shoulder. Bring it down here, okay? Internal, external rotation, okay? These are very wonderful. And then the third one, what you do is you want to stretch the piriformis muscle, which is the hip rotator, very important one. And so you grab your knee like this, either the knee and pull back, or you can hold, if you have knee issues, grab the back of the thigh, okay? And pull. Every 10 seconds, you pull back. Your head is, of course, down. You can use a pillow to rest your head on. And it's important to do these on a firm surface. You cannot do this on the mattress. Anything soft, it has to be firm. Then you do the other side, the same thing. You cross it, you grab it, either from behind the knee or below the knee, and then just pull back every 10 seconds, okay? 3 times, okay? Now, the last one I want to show you is the hip flexors, okay? And these are what we call the psoas muscle, and these are done well this way. And basically what you do is you one knee is bent and one is in this position, basically 90 degrees, okay? And you're sitting up straight. And what you do is you lean forward like this. Make sure that you keep your body straight, and you feel a nice stretch right in here. This is a very powerful stretch, the piriformis muscle, because this could be the muscles that's holding everything stiff. But you gotta do the whole thing. So you notice, you hold it, and you repeat this maybe 5 times or so. You can work yourself up. If you only can do 3, 4, that's fine, and then you could do more. And then switch, okay? Same thing, okay? One is bent and one like so, and you again, you come forward. You don't want you to do this or do this. That wouldn't work. Keep your body up straight and just bring your body forward. Translate it forward like this, and hold it for like 10 seconds, and then come back. Okay, you might want to take a deep breath in and breathe out. Relax. Take your time and just gently. Don't rack it or snap it. It's a very powerful muscle to stretch. Okay, you hold it 10 seconds. Come back again 3 times. Okay, and then when you get up, you can go back and just do simple rotation like so. Just put your hand around your waist and go around this way. So that way, this will help break any scar tissue or any tightness around the hips, because the hips, they're attached to the back and legs. So these muscles have to be loosened up. So you can do clockwise rotation like so, okay, 10 times, and then you do counterclockwise rotation, okay? So do these exercises twice a day. If you feel any soreness in the hips following these exercises, you can put some ice packs on it, 15-20 minutes to calm them down, especially if you haven't done them for a while, and if there's some irritation, that'll calm them down. But if it's not tender or not, you don't have any symptoms in it, that's fine. And then do them in the morning and do them at night, and do them on a regular basis. And I hope this video will help you achieve flexibility in your hips.